let's talk about something called hidradenitis suppurativa, or HS for short. For a lot of people, it's this really confusing, frustrating, and painful condition. And honestly, if you've never heard of it, you're not alone. But you're about to learn about a chronic skin disease that's way more common than you think. So, in this explainer, we're going to pull back the curtain and demystify HS together. So let me ask you this. Have you, or maybe someone you know, ever had to deal with these painful bumps that just keep coming back? You know, in those places where skin rubs together, like your armpits or the groin area. It's so easy to just write them off as boils or something. But if they're a reoccurring problem, it could actually be a sign of HS. And this is way more than just a minor skin thing. It can really impact a person's life in a big way. So here's our game plan for this explainer. We're going to break it all down. First, we'll get a solid definition of what HS even is. Then, we'll dig into the root of the problem. After that, we'll walk through the 3 stages of HS, explore how it's managed, and we'll wrap up with some key takeaways for living with it. All right, let's jump right in. First things first, what in the world is hidradenitis suppurativa? To really get a handle on it, we need a clear, accurate definition. Okay, so here's a super interesting and really important point. The name itself, hidradenitis, is actually kind of misleading. It makes it sound like a problem with sweat glands, right? But what we now know is that's not the case at all. The real problem starts deep down in the hair follicles. That initial blockage is what kicks off this whole chain reaction of inflammation, pain, and swelling that really defines HS. So if the whole thing starts with a blocked follicle, what's causing that blockage to begin with? This gets us right to the root of the problem. And believe me, there are a ton of myths out there about what causes HS. So let's clear the air and set the record straight. If you take away just one thing from this part, please let it be this. HS is not an infectious disease. It's not contagious, and it has absolutely, positively nothing to do with being unclean or having poor hygiene. This is probably the biggest, most harmful stigma attached to HS, and it's just flat out wrong. Okay, so if it's not an infection, what is it? Well, the truth is, it's a really complex puzzle. HS is what we call a multifactorial disease, which just means a bunch of different things contribute to it. There's often a genetic link. About a third of people with HS have a family member who has it too. Hormones definitely play a role, and so do certain lifestyle and environmental factors. But the real main character in this story is the immune system, which just goes into overdrive and creates all that intense inflammation around the hair follicle. And this lays out the process perfectly. Think of it like a clogged pipe in your sink. A hair follicle gets plugged up with keratin. That's the protein that makes up our hair and skin. Then the follicle starts to swell up, and it can even burst under the skin, spilling all its contents. Your immune system sees this as a threat and launches this huge attack, which leads to all the pus, the pain, and eventually the tissue damage and scarring. Now, this whole inflammatory process doesn't look the same for everyone. It can get worse over time. And to help understand that progression, doctors use a pretty simple classification system to sort HS into 3 different stages of severity. So stage 1 is the mildest form. At this point, someone might get single bumps or a few abscesses that can be pretty painful. They might come and go, but the key thing here is that there isn't any permanent scarring yet, and none of those sinus tracts, which are basically these little tunnels that can form under the skin and connect the abscesses. Then in stage 2, the disease is considered moderate. The abscesses are coming back more often, and we start to see those sinus tracts and scarring begin to form. The main difference here, though, is that there are still patches of healthy, normal skin in between the areas that are flaring up. And then we have stage 3, which is the most severe form. At this point, the inflammation can become widespread across a whole area of the body. You'll see multiple interconnected tunnels and abscesses, and they leave behind some pretty extensive scarring. At this stage, there's very little, if any, normal skin left in that affected region. Now, I know seeing that progression can feel pretty daunting, but here's the good news. No matter what stage someone is in, there's a path to managing this condition. So let's take a look at how HS is actually treated. The treatment approach is really tailored to the specific stage. For stage 1, the main goal is just to reduce new flare-ups, and that's often done with topical creams or oral antibiotics. For stage 2, the focus shifts to controlling the flares and trying to limit scarring, usually with stronger therapies. And for the most severe, stage 3 disease, doctors might use powerful drugs called biologics, which are these specialized medicines that target specific parts of the immune system, or they might even recommend surgery to remove the affected tissue. You know, managing HS effectively means looking at the whole person, because HS doesn't happen in a vacuum. That chronic body-wide inflammation that drives HS is also linked to other inflammatory conditions like Crohn's disease and even metabolic issues. And just as important, the physical and emotional weight of this disease means that depression is a very real concern that really needs to be on the radar.
And that brings us to our final section, the practical side of actually living with HS. What are some of the key takeaways and lifestyle factors that can really make a difference?
So what kind of things can influence the risk or the severity of HS? Well, the data shows it's about 3 times more common in women than in men. And beyond that, research points to 2 major risk factors you can actually do something about. The first is smoking, which can literally double a person's risk. And the second is obesity, which adds to both skin friction and overall inflammation in the body.
So, what can patients do? This slide gives us some really great actionable advice. Simple stuff, like wearing loose-fitting clothing, can cut down on friction and irritation. But the bigger, really important conversations to have with a doctor are about quitting smoking and finding healthy weight management strategies. And finally, because this disease can feel so isolating, finding a patient support group can be an absolute game changer for finding community and understanding. So we've defined HS, we've busted the myths, and we've looked at the path to management. This really brings us to a final and I think very important question. Now that we understand what HS is, and just as importantly, what it isn't, how can all of us help foster more support and less stigma for the millions of people who are living with this every single day? That's definitely something worth thinking about.